righty, good day, beautiful people, and welcome back to the Dr. Coach Show. I'm your host, Dr. Coach Danny Pueblos, and today I have my good friend and certified athletic trainer, Carlos Roel. How you doing today, Carlos?
Doing all right, man. Doing all right. Happy to be here, man.
Well, I appreciate you being here, brother. I see all the hard work you're putting in. You're grinding out there and all over the place, man.
Yeah,
And
man.
I know you wear a lot of hats, and I look forward to hearing about that. That's why I wanted to bring you on to share your experience, your journey, and also give people insight about what life looks like about as far as what you do. And especially I know people, there's some people on here who watch, and listen and for advice or for guidance of like, hey, like, I want to do what he's doing, or I want to do what she's doing, and and this is that's probably one of the biggest reasons why I do this stuff. I love these things. It's a good fun for me and my guests, but just the biggest goal of this is to provide insight to people, to whoever watches and listens, and compared to there's only so much you can learn of a textbook or
Yeah,
so
big
much
time, man.
you could Google. So why not bring the source here, right? So again, thank
Hmm.
you, brother, for coming on.
Hey, anytime, man. If I can help somebody with my story, then perfect. Cool. I love students, especially athletic training students, PT students, any students that are want to get into sports med or I don't just do sports med, I also do like the general population. But if I can educate somebody or give a little bit of insight, then I'm always down, man. Because I used to be in that shoes. I always wanted
Yeah.
to be the person that I am today. So um, if I can help somebody be their future them, then cool.
Love that, man. I love that. See, this is why we click, man. Because I'm the same way. I always try to pay it forward as much as possible, and just
Yeah,
just like you
man.
mentioned, I was the same thing where I didn't really have any guidance, and and especially in my field, it was still fairly like not. It's been around like it's more sports psychology, but it hasn't really got picked up ground until recent years, and so I was going in kind of taking a leap of faith. I'm like, I understand the importance of this stuff, but
Hmm.
so now, I get hit up, quite often from people and students or just random people asking questions and want to learn. And I'm like, yeah, please, like I'm here to, I want to help you, because I wish I had that growing up, with, I had the love and support of my family doing all that. And I love
Hmm.
that. But as far as like the career and like, the industry, I was kind of going in blind, so I
Yeah.
appreciate your take on that as well. So let's talk about that. Let's talk about your
Yeah,
journey.
man.
So kind of take us from the beginning, right? So start from the beginning as far as, why you decided to get into this field and what have you experienced? What are some highlights, if you will, ever since?
Yeah, man. So it started. I always like think back and the subconscious Carlos, little young Carlos. So I'm gonna date myself, but back in 1996, little Carlos sitting watching TV, and in '96 we had the Atlanta Games, Atlanta Olympics,
Hmm.
and I remember sitting on the floor, back resting on the couch, old school couch. I forgot the pattern of the couch. Anyways, old school pattern.
Yeah.
Um,
Did you have that shag carpet though? Did you have a shag carpet or
and,
no?
uh,
Okay.
for a little bit, we did. We took it out. We put wood
Yeah.
flooring, but we had shag for a bit.
Yeah.
Yeah. Um, But I remember watching the Atlanta Games, and for those of you that aren't familiar with the opening ceremony for the Olympics, it's they go in by alphabetical order. Each country goes in, each nation goes in by alphabetical order, and then the last country is always the host country. And it being, home turf. Actually, let me take a step back because I want to let people know that my family, were Peruvian descent. So I was born and raised here in LA County, but majority of my family is still in Lima.
Yeah.
So nations come in during the games, alphabetical order. Peru comes out. Like, yeah, my whole family's, yeah, Peru, Peru, vamos, Peru, let's
Yeah.
go. And I was like, dude, that's pretty cool, man. Just seeing the athletes come out and, taking pictures. Back then it was this camera versus like this camera right here.
Yeah.
Um, and, um, and then, okay, they pass. And then the last country, host country being the United States,
Yeah.
we see all of the athletes, just so many athletes come and flood the stadium. And I'm like, dang, that's so cool, man.
Yeah.
So I think that's where my like Olympic Paralympic journey started. Um, that's the closest thing that I can like remember that drove me to seek the path that I took. Parallel with that, back in the days, the National Geographic came out in magazines, and I
Yeah.
remember getting the magazines and just seeing the pictures of just the different locations, different people, the different foods, the different animals. I'm like, dang, that's pretty cool.
Yeah.
Seeing all those pictures, and then combined with going back to Peru, seeing my family, seeing the cuisine over there, hanging out, in Lima, going to Machu Picchu, Cusco. I was like, dang, at a young age, I was exposed to different colors of the world,
Mhm.
and I wanted to see more of that. And so another subconscious goal. So my first subconscious goal was Olympics, Paralympic journey. Second subconscious goal was see the world and hopefully get paid to see the world. So as I matured, got into high school, I realized that I liked to problem solve. My father, he was a mechanic, worked on cars. I was always inside of engine compartments and just helping my pops out. And so, helping him problem solve, I like that process of problem solving. And so I found that same problem solving ability can be applied to the human body. So I was like,
Mhm.
cool, maybe there's something that I can choose that can help me get paid, see the world, and uh, do something I love, which is problem solving. And you know, I love the human body.
Mhm.
So I learned of the term sports medicine. Just the term sports medicine. It's just a broad term. And I was like, that sounds pretty cool. I'm gonna look into that. And so under the sports medicine umbrella, there's different disciplines, sports psychologists, there's physicians, massage therapists, chiropractor, physical therapists, athletic trainers, um, PAs, acupuncturists, all that under sports medicine. I might be missing a couple, but um, I learned of physical therapy and I was like, oh, cool. I'm gonna check that out. And so I worked in a physical therapy clinic in Arcadia, the city of Arcadia, which is in LA County. And I was there and I was like, cool, this is cool. I can see how the physical therapists are problem solving. But that clinic saw majority Medicare aged patients. So these are like old patients and I'm like, dang, I'm scared. I don't know how to work with them. I don't
Yeah.
want to work with them because I might break them. And that was just young Carlos. I just didn't know
Yeah.
how to work with them. So I was
Yeah.
scared. I was scared, man. So I was like, nah, I don't old people, not for me. And then I had heard of the term athletic training or the discipline athletic training. I was like, okay, that seems like more my style because you're out in the open, growing up in Los Angeles County, the weather is beautiful majority of the day of the year. I'm like, cool, I think I can do that, because I'm not in an office. I don't really like being in a certain spot and sitting in front of a computer because there was a time where I became a computer science major right after high school. Yeah, it was
Wow.
a brief period, super brief. And I was like, no, I can't do that.
Yeah.
So I went back into the human body because in high school I went through a health academy in my high school, college, computer science, and then I went back to the health field, but learned about athletic training and I went that path. I chose the athletic trainer path. And as I was in the athletic training program, I learned more about it. I learned that the hours were crazy. There's a kind of a unwritten rule between athletic trainers, especially if you work American football. If you work American football, then you cannot have a baby during American football because you can't miss time. You can't
Yeah.
because you're working in football. And I was like, dang, that kind of stinks. And then back in my days, the divorce rate with athletic trainers was high also. I was like, dang, man, I love the art and philosophy of athletic training. I just don't like these other statistics, the divorce rate, the unofficial statistic of, short or low birth pregnancies and births during the football season.
Yeah.
Uh, and I was like, nah, man, okay. graduated from the athletic training program, and then I realized I only needed three more classes to become a physical therapist, or sorry, to go into PT school. And so I took a year between my athletic training, uh, uh, me graduating with my athletic training certificate, and then starting my doctorate program to do the three courses that I needed to do to get into the doctorate in physical therapy program. So did that, got into PT school, graduated PT school, which is where I learned how to work with the scary population, which was the Medicare age population. And I fell in love with working with that population too. So, e- especially with the neurologically involved population. And so I had this passion of working with athletes, working in athletics, and then this passion with working with the neurologically involved population. After PT school, I did a residency up in the Bay Area in Vallejo, California. It's a Kaiser residency. It's the proprioceptive neuromuscular facilitation, which that population was neurologically involved, heavy uh, injury, like a car accident, like multi-trauma. And it was in the rehab setting, the physical rehab setting. So there I honed my skills to work with the neurologically involved or the multi-trauma involved population. Came back down to LA and then got a part-time job with the physical therapist who works with USA Beach Volleyball, and she got my foot in the door, or I should say, she helped me get my foot in the door with USA Beach Volleyball. And yeah, worked one season with USA Beach Volleyball, got in with US Soccer that same season, got in with USA Fencing. Um Fast forward to last year, now I'm working with USA Cycling. So I work with four USA teams now, and yeah, man, I travel the world, I get paid. And it's not a lot of money working as an independent contractor working with the USA teams. So that's one thing that I for sure tell all my students is that as an independent contractor, you're not going to get rich working with the USA teams. Yeah,
Hmm.
man. But I get paid still, and I see the world, and it's been fun, man. It's been fun. It's been a lot of growth personally too, man. Yeah, it's been a lot of growth.
That's awesome, man. And I do want to apologize because you know what? I want to re-emphasize you are not only Carlos Roel, you are Dr. Carlos
Oh,
Roel. So
that's cool,
you,
man.
you've earned those two letters, okay? And
Thanks, man.
I want to make sure to clarify that. So apologies for that.
Oh
Um,
no, you're good, man. Thank you. Appreciate it.
absolutely, man, absolutely. So um, appreciate that journey, man. That's a great journey, and
Hmm.
sounds to me like you fulfill that, those dreams that little Carlos wanted as far as being able to see the world, get paid for it, you know,
Yeah, man.
and being
Yeah.
able to help people along the way. I mean, I can't think of anything better, you know.
Yeah. Yeah, it's fun.
And so, we're having worked with the U.S. Olympic and Paralympic Committee, as well as your patients and clients on the side. Um, what are some like key differences? Obviously, you have like age as a factor, right? But has like one or either one of your population that you work with. Um, is there like any significant differences there, or as far as your approach to that, or like talk to me about that? Because
Yeah, great question, man.
it's pretty, because usually, when I talk to people who specialize in certain things like this, they kind of stick to one population. But the fact that I see you, putting the work on both ends.
Mm.
So talk to me about that.
Yeah, man. When I was in the residency up in Vallejo, California, one patient sticks to my mind. Multiple do, but this one event with this one patient sticks to mind. She had suffered a infarct in her spinal cord. So it was like basically a vessel in her spinal cord ruptured, and she became a non-traumatic spinal cord injured patient.
Mm,
Super sad.
yeah.
She had trouble standing, rolling in bed, moving in bed, walking. It's just very, very tough for her. We helped her something super simple that us able-bodied people we take for granted, rolling from her back onto her right side. Super simple. We helped her do that. The joy she had after achieving that, after her spinal cord injury, was the same joy I see like an Olympic PRing, an Olympic athlete
Yeah,
PRing. It's the same parallel, the same joy.
yeah,
And so that made me think like, wow, that's like it's we're people, we're all people, we
sure.
all feel the same joy, we all feel the same pains. And so my approach to the Olympic and Paralympic athletes is going to be the same to your general population person. Uh, yeah, man, because of that one moment in time, that
Mm.
seeing her roll to the right side and then be super happy, and she can't jump, but she was like super ecstatic. Yeah. So yeah, I treat them the same. And you mentioned my clients. I based the name of my business, Aro, Auro. It's a take from the chemical term aurum, Aurum, which means gold in the chemical, in the table of elements. Thank you. Sorry.
Yeah.
Uh, but because I want to give this gold medal treatment to not just the Olympic and Paralympians, but also to the general population. So I give that gold medal treatment to them. So yeah, it's a great
I love
question,
it.
man.
Yeah, no, I love that. I love that. And man, I can't imagine that feeling that you had. I mean, it's like being a proud coach, proud parent. I mean, as
Yeah, man.
helping and just the stuff that we take for granted, right? Just being able to sit up or turn in bed or walk, it's just
Yeah,
we don't realize how how quick those things can be taken away from us. And just having certain injuries, myself, not to that level, but just
hmm
not be able to have function of my hand or not be able to turn my hand or not be able to walk, for like, ankle injury or back or whatever.
Yeah, man.
It's like, man, it's stuff we just take for granted sometimes. I know it's helped me gain an appreciation for just the smallest things, just being able to wake up every day, be able to see, be able to walk and breathe, because
Yeah,
I
man.
had that luxury.
Yeah, yeah, yeah.
So with the different teams that you've worked with on the Olympic side, um, so when you're with them, is it on like a needs basis? Like how often are you with them? Does it depend on the sport? Talk to me about your experience with these different events and sports.
Yeah, it ebbs and flows in terms of how many times a year I travel with them. I travel internationally with all of them, and with fencing, and fencing. Actually, I travel domestically and internationally with all of them, but most of the time I travel international with them. And it does ebb and flow. Um, the last year being an Olympic year, 2024, I traveled quite a bit with USA Fencing. And 2023, I traveled a lot with US Soccer. So it kind of just depends each year. The last 2 years, I didn't travel at all with USA Beach Volleyball. But this year, I am planning on, I'm scheduled to travel with them in September, internationally. So it kind of just ebbs and flows. With USA Cycling, I'm actually, because I'm with their speed track team in Los Angeles, and I'm more in-house and not really traveling with them. There hasn't been talks about me going overseas with them, but just me staying and taking care of the athletes in-house. Um, Potentially, there's potential that I travel with cycling, but my main thing is to stay with them. And so yeah, it kind of just depends. I want to say the last 3, 4 years I've traveled the most with USA Fencing. Second would be with US Soccer, and then third beach volleyball, and then most recent just in-house with USA Cycling. And it kind of just depends on what's needed from the team, because each team has a pool of clinicians that they can choose from that can go to each of the events. As beach volleyball, USA Fencing, there's so many tournaments, so many teams that are going to need support. US Soccer, there's the senior team for men's and women's, there's the junior teams, and then there's the extended national teams, which is futsal. Um, it used to be called Paralympic, but it's called CP, the cerebral palsy team. That's men and women, and their beach teams as well too. I may be missing a couple, but so many teams, and each each team is gonna need a clinician, and then there's this pool of clinicians from each of the, we call it national governing body, NGB, NGB equaling the USA team. I hope I didn't lose you or anybody else with that explanation, but
No,
yeah,
no, you're good.
yeah. So because I might say NGB again later on.
Yeah. Okay. Yeah.
Yeah,
No, that's a good, that's why the rewind button is there, right? So,
yeah,
in case
true.
someone needs, in case someone needs that clarification.
Uh-huh.
So that's awesome, man. That's awesome. So, like, do they call you if they need you? I know you're part of that pool, right? So, how does
Yeah.
it work?
Yeah, it's just emails.
Email?
So
Yeah.
yeah, and let's go with USA Fencing.
Okay.
We'll use them as an example. So the medical director, she gets the schedule for each season, and she has to figure out where she's going to travel to, and then figure out what other teams are going to need support. And so she picks from the pool of clinicians and sends out an email blast like, "Hey." Um, to each of the clinicians in the pool. She says, "Hey, everybody, fill out your schedule for the year. Give me your availability, and I'll get back to you with potential locations and dates." And so that's what she does.
Got it.
And yeah, and that's very similar with USA beach volleyball. US soccer is, I believe it's something similar, but I think there's just a little bit more change throughout the year in terms of like added tournaments and added training sessions and added um, tryouts, things like that. Because there seems to be a little bit more ebb and flow and change with US soccer and their season.
Got it.
Yeah. hmm
Got it. And have you ever been to any of the Olympic Games?
Yes, great question. Yeah, that little Carlos was happy in 2016 in the Rio Games. Yeah, so I went with back then it was called Paralympic soccer, like I mentioned, but now it's called CP soccer or cerebral palsy soccer. And
Mm,
so I got to go to the Paralympics during the 2016 Rio Games and got to yeah, reach my dreams and I didn't get to walk out in the opening ceremony. That's still on my to-do list, but I
yeah,
did get to hang out during the closing ceremony on the stadium floor. So
that's
that
awesome,
was
man.
awesome. Yeah, man.
So how was that
Yeah.
experience? So, like being at the games, what does that sort of day to day look like for you?
Yeah, so the team manager has a set schedule with each day, what days are we going to train, what days are rest days, what days are going to be travel days. So we have the schedule already ahead of time, maybe like a week or two ahead of time. So we follow that schedule, but I guess it's your at least for me, I'll speak for myself, and I can say for the majority of the athletes and staff as well too, that it's like it's game time. And it's game time from the time you land on the soil where you're gonna play to you finish your last game. And so we're still like joking around, playing around, having fun, but we're dialed in, all of us. Every single person is dialed in because we're there for a reason. It's called
Yeah,
the selection team. We're all selected, so we're all just dialed in.
yeah,
And yeah, man, it's us versus the world, pretty much. It's us
literally,
versus the world, literally.
literally, yeah,
Yeah, man. Yeah. And it was probably like the most stressful tournament that I've been to, but the best tournament that I've been to. Yeah, it's hard to explain all the emotions. Again, I mentioned the happy times because w- in my time with sports medicine, just in general, there's a lot of laughter, a lot of fun to be had amongst the
yeah,
athletes, amongst the staff. And so I remember in Rio, we just kept that laughter, we kept that up. But there was also the worry of performance. There is again, these rainbow of emotions. The pride is very, very powerful too. If you, for those of you watching this that haven't realized, but a lot of times the national teams and most teams in general, they have the logo on the right side of the chest. Because when we do the Pledge of Allegiance, it's hand over the heart, hand over the crest. And so every time we did the Pledge of Allegiance, like just that pride shows up too, man. And it's one of the cerebral palsy athletes, he equated it to being in the military and representing the US overseas. That was his dream. He couldn't because of his disability. He had cerebral palsy. His
Yeah.
left side of his body didn't work that well. So he said that being on this Paralympic team was equivalent to him like being able to be part of the US military. And I was like,
Yeah.
dang, that's
Wow.
actually pretty powerful.
Yeah.
I see that parallel. That's pretty cool. Um, yeah, and the war is different. The war is on the field or the war is on the court. The war is in the water during the Olympic Games versus, different war when you're in the military. Yeah.
Yeah, that's powerful, man. That's powerful stuff. And be able, and be, so him, him and his goal, I'm sure, um, it's one of many, just dreams and
Oh
goals
man.
and journeys that, every athlete has, of getting to that level and represent your country,
Yeah, man.
that's awesome on the biggest stage, and that's awesome that you've been able to be a part of that. So
Hmm.
that's great stuff, man. So,
Thanks, man.
during your time working with the athletes across all the sports you've done, what are some things that you typically do with the athletes, just so everyone's listening or watching
Hmm.
has an understanding about kind of more or less of what you do with athletes.
Yeah, so I'm an athletic trainer, doctor of physical therapy. So both of those disciplines, they have a lot of overlap. Let's talk about athletic training first. So athletic trainers, the way I like to describe what athletic trainers do is they are kind of like EMTs, and they have some EMT skill set, they have physical therapy skill set, and a lot of administration skill set too. Physical therapy, you have injury, or I'll take a step back. With physical therapists, you have movement assessment. They're movement specialists, or we are movement specialists. So we assess movement. We try to decrease the chances of getting injuries. If somebody does get injured, we assess the injury and then we rehab the injury. And so there's a lot of overlap between athletic training and physical therapy. Physical therapist, traditionally in physical therapy school, you don't learn the emergency medical responder components of sports medicine.
Hmm.
So when I work with these teams, I do as much injury prevention as possible, whether it's a movement screening or whether I'm trying to do some prophylactic taping of their joints to try to minimize, excessive mobility or something like that. Um, And then if they do get hurt, then I'm running onto the field and I'm assessing their injury right there on the spot. And I am triaging, trying to figure out what the next steps are for that athlete.
Hmm.
Do we need to spine board them? Do we need to cart them off? Do we um, uh, pick them up, take them to the sideline, do a secondary assessment? Before we do a secondary assessment, can they go back onto the field and finish?
Yeah.
If not, do we take them out? So we do that, and then we do the rehab of the injury after that too. So it's like athletic trainers have kind of been coined the Swiss Army knife of clinicians. So I think most sports medicine clinicians are Swiss Army knife of sports medicine because there's also sports medicine chiropractors, sports medicine physical therapists. Um, as long as you're working as a rehab specialist in sports medicine, you kind of have to be a Swiss Army knife and just be versatile with your skill set. So that's pretty much what I'm doing. Yeah, which is different than my private clients. I don't have to really do any emergency response assessment
Yeah,
unless something traumatic happens and they fall down the stairs or something like that.
sure, sure.
Yeah. Yeah.
Yeah, thanks for the insight, man.
Uh-huh.
And yeah, you definitely are a Swiss Army knife. I know, having been an athlete for many years and coached for many years, you know, the trainer, the doctors, you know, I mean, they're right there. They're a big part of, you know, the whole process. So I appreciate what you
Mhm.
do, man, because I know it's every athlete, every situation, its own challenge, you know. Um, Now, what I do want to talk about and ask you from your perspective is sort of like having a bringing both of our worlds together, right? And my role
Mhm.
with mental performance and you and yours. Um, you know, one thing I learned as an athlete and as a coach is a lot of times the first point of contact of an injured athlete is a trainer, right?
Mhm.
What have you experienced as far as the different mental and emotional challenges from athletes after sustaining an injury?
Yeah, no, it's a good one, man. I would say the most common one is the confidence to go back onto the field or go back onto competition and having the confidence that they're not going to get re-injured again. That's probably the most common one that I've seen. Um, and that's where like somebody like yourself and myself, we really have to communicate between us and also with the athlete and show the athlete the confidence that, hey, you're ready now. Your body's ready. It's ready to go back. It's probably stronger than it was before. Um, so I would say that would be the biggest thing is just the confidence to return to play. If I had to choose a second one, let me think.
Now, real quick before we move on,
Yeah.
so how have you done that? How have you helped athletes, if you have, um,
Hmm.
with kind of gain that confidence back? Because I know I have. I know, um, you know, with from you know my experience, it's you know we have this it's a three-part process, right? I mean, not just mine,
Hmm.
but yours. You have the initial onset of the injury. You have the rehab and recovery process, and then return to play, right? So when you get those athletes who are cleared to play, right? They're good to go, but they're just not ready mentally and or emotionally.
Hmm.
What have you done, to help with that?
Yeah, I like to go back to the notes that I take on each of the intervention sessions that I have with the athlete. So that way I can track the changes. And so if I were to reiterate their words that they've told me during session and like start with their words right after the injury and then use their words after like let's say a month after the injury and show them that hey your words have changed. You went from like having, we'll say pain, an easy example. We'll say, oh, you've been in a lot of pain right after the injury, and now your pain is 0.5 out of 10 or 0 out of 10. Um, so I like to actually like tell them, hey, this is what you've told me. That, and then I also going back to my documentation, like, hey, these are the actual numbers of your performance. This is how you've progressed. This is how you got stronger. This is how your quality changed from day one post injury to 1 month post injury. So it if they can see, vision is powerful. If they can see their change, then it's a little bit more powerful for them. It connects with them a little bit more. Whether that whatever they're seeing is written down because I wrote it down, or let's say I took video of them on their cell phone and have them track their quality of movement as they progress. Um, Vision is powerful. So combining their vision of what they're seeing with their vision and then me telling them, it can help them to
Yeah,
get past that barrier of confidence or lack of confidence.
got it, got it. Yeah,
Yeah.
thank you for that. Yeah, it's such a common challenge for athletes, and
Yeah.
having been injured myself many times playing football,
Hmm.
baseball, and basketball. Um, I remember that time where it's just um, like I'm cleared to go, but I'm so afraid to like put pressure on the ankle, I broke, or
Mm,
make a cut or whatever it was, with my strained knees or whatever, So yeah, definitely important process, man.
yeah, man. Yeah. And then combining forces with you too. I mean, your work is powerful too. I would say every athlete needs a mental performance clinician to help them out too. Everybody. And it's crazy to say, but a lot of these high level athletes don't have that, don't seek it. And I think it's just like there's physical therapy. We're not just bodies and pulleys and anchors. We have a brain that processes emotions and things like that. So we need that mental therapy as well too.
Yeah, I appreciate the shout out, man. But it's so important because like get the
Yeah,
word
man.
out, man. Like I'm doing my best in
Oh,
my
as
little corner of
much.
the world to like make people aware of what we do and the importance, and that's why, like when I mentioned when I started my educational journey, I knew I got into psychology, right? I did my undergrad in psychology, and then at that point, I was like, do I want to go the clinical route, or do I want to pursue this thing called sport and performance psychology? And
Hmm.
I knew and obviously to this day, I still understand the importance of the clinical, practice and that side, helping people, right? But I just, when I heard about the whole sports psych stuff, I was like, I know that's where I need to be because I was
Hmm.
born into sports. And like when people ask me, I get asked this all the time, why did you get into the field? And it's easy. My two passions in life are helping people and sports. And when I found out about that career, just like you, right? Like if I
Yeah,
can do
man.
what I love, being around athletes, and get paid for it, that's a dream.
Dude,
That's a
yeah.
dream. And so yeah, I know for me, like on our field, I've seen the field progress and grow so much over the past. I mean, I've been doing this for about 12 years now, and just from that time period, it's progressed so much. A lot more athletes are using this stuff, and
Hmm.
I know even the Olympic Committee, they've been doing they have sports sides. They've had those for
Yeah.
a while. But you see other sports like professional baseball, I would say they're ahead of the game as far as like the major sports you see. And American football is catching up, basketball and these other sports are catching up and realizing, hey, this stuff is important, right?
Hmm.
And I even had a colleague of mine who we did our master's program together in exercise psychology, and she was she until this day she's still a collegiate athletic trainer,
Oh,
because
nice.
she understood, that she's going to get, so she has a dual master's, but she understood how, as I mentioned before, when athletes get hurt, right, they're in the training room, they're with, the therapist and the physical therapist, trainers, all that stuff, and they're talking about, what they're feeling. They're talking about, I don't know if I'll be like,
Yeah, man.
I don't know if I'll be the same athlete like I was before, I don't know if I can make that cut, and
Mm,
so it's so important, especially with the injury component. Every sport, this injury is a part of the game. Some more than others, and
yeah.
helping athletes deal with that. And and I just gave a talk last week to a bunch of football coaches at a big clinic and a conference. And I was talking about that. I was talking about how when because I was basically talking about how to identify common mental challenges in football and how coaches can address them. And one topic I brought up was injury and how they have to recognize that each one of their athletes are different, right, and how
Yeah.
they
Big
respond
time.
to these adverse situations, especially injury. Um,
Hmm.
and some they get hurt and then they're like, all right, like let me start rehab, and they're all about it. They're like, go go go, right, and they're they're ready to go back when they're cleared. But others, they might not have that same kind of approach, and they might not be wary about I don't know if I'll be able to be the same. And
Mm,
obviously, the severity of the injury matters as well. But if there is a chance to come back, I just everyone's different, and you have to treat it as such. So it's because injury and that whole process is so common across sports. I think at the very least, yeah, there's obviously what you're doing is so important, but also addressing the mental side, of
big
every
time, man.
aspect of it is so vital. And even when I've had conversations with whether it's coaches or like collegiate athletic departments about incorporating mental performance training, with their for their athletes, Um, and I hear where they don't really care to do that or they don't prioritize
Mm,
that. I'm just like, yeah. And
dang.
I told these different schools, universities, like I'm in the office of these ADs and assistant ADs and trying to I'm not selling them like a used car or anything like that. I'm telling them about the importance of this stuff. I'm like, hey, I'll
Yeah,
give me specific examples. U.S. Olympic, Olympic and Paralympic Committee,
big time.
MLB, NFL. I mean, the
Yeah,
list goes on, right? Even
yeah,
UCLA, USC, they all have mental performance, programs. And you're going up against these programs, and you're not going to address it. And how do you expect to compete when you're not giving the resources to your athletes?
yeah, man.
So it's frustrating. But the good news, I'm an optimistic person. And I know it's going to continue to grow. It's going to continue to be implemented. And that way we're able to address every aspect of performance, right? With a professional like yourself on the physical side, and then here I come with the mental side, right?
Yeah,
Just
man.
to be able to help the athlete, just and in every athlete, not just in sport, but in life as well, and because even the athletes are at some point they're gonna have to hang them up, right? They're gonna have to hang up their cleats, their shoes, or whatever, right? And
Big
um,
time.
being able to
Yeah,
take care of
and
their bodies and take care of their mentality, right? I mean,
yeah,
I'm set up for during and after sport.
yeah. I like that during and after sport because you're right. They, I just had a conversation with somebody yesterday, even about how as the physical rehab side, we have to be an advocate for the athletes so that way they're not killing their body too much. So that way when they have grandkids, they can roll around on the ground with the grandkids and be
Yeah.
able to get back up without, dysfunction and stuff like that.
Uh-huh.
So yeah, I agree with what you're saying, man, because they need that for the mental side too. And I'll add to that too. Me growing up as a brown dude in a brown culture, the Latino culture, brown guys aren't supposed to get mental health services.
Yeah.
We're
Yeah.
considered loco. Oh, it's that's loco, Carlos.
Yeah.
No,
Yeah. It's
like
true.
you're crazy, Carlos.
Uh-huh.
But I myself have been a recipient of mental health services. I'm an advocate of it. I try to preach it as much as I can to everybody, not just athletes, but to everybody, and especially all you brown dudes out there, man. Yo, you,
Or just
yo,
dudes in general. Just dudes in
dudes
general
in
too.
general.
You
Yes,
know?
dudes in
So true, but
general, man.
especially the brown dudes and just
Yeah, man.
certain cultures, regardless of
Hmm.
skin color, it's just like machismo and
Machismo,
um
that culture, that machismo culture is yeah,
yeah,
oh man.
it's still rampant. It's still it's gotten
Hmm.
better overall, but a lot of work
Yep,
needs to be done.
exactly.
And now that we're talking about this, going back to that football conference I spoke at, I was curious about how I would be taken in. I'll be honest with you because
Yeah.
I used to attend this conference when I was coaching football, and that kind of conference is it's basically 99% of it is just talking about like fundamental stuff, like how to or like scheme stuff like defense, offense, right? How to block, how to do this defense 4-3, 4-2-5, just different things, right? So here I come to be asked to talk to at this conference, talk about the mental side of performance, and um, I know that football being a machismo sport overall, I was curious about how the turnout would be, and you know, I had a decent turnout, not as much as I would have want, and the coaches who did show up were on the younger side, of
Okay. Okay.
which I'm not surprised because
Hmm.
you know because I've heard in the past from especially like more seasoned coaches who've been around a long time and we're we don't need to talk about that mental stuff, right? The safety stuff, right? And so that's why I acknowledged before I even spoke about the content I was there to speak on. I told the coaches who were there, like, I appreciate you guys being here and the fact that you're open to this. It tells me a lot. And because this stuff is because everyone is doing the same drills. Everyone's working out in the weight room. Not everyone's working on this. You know,
Yeah.
and it's so important. It's so important. So yeah, I went to my talk, but it's just it's evidence, continued evidence of how much work needs to be done on that side of performance.
Hmm.
And so, if we get the word spread out even more, that's why I'm like, hey, whoever was there, I appreciate y'all, and keep spreading that word, and try, try this stuff. All right, give it a shot, and it can't hurt. I put it that way. It cannot hurt. Okay.
Hmm.
Because I know some coaches, they're a little weary on certain things I was saying, and I was like, trust me, like, look at all these athletes, look at all these teams who are implementing this stuff, and you're seeing results, And there's a coach, that was listening in to my talk, and he came up and talked to me after. He's like, yeah, he's like, actually, I started doing this past year. He's actually
Nice.
started doing this because I was getting therapy for myself, and I started
Mm.
using some stuff I was learning, with my players, and he's like, it's made a world difference. He's like, I'm not saying this was it, the end all be all, but he's like, we're coming off, see how you have championship, So I'm like,
Okay.
here you go, So
Yeah.
I'm sure that played a role in that, So
Uh-huh.
so anyway, yeah, it's so important, and to be able to address both the physical side, right, and the mental side, and it's
Yeah, man.
at any level, and I know because usually like what I've seen as far as how things work, right? Like usually either the Olympians or the pros start doing something, and then colleges see that and they start implementing it.
Hmm.
High school start doing it, and the youth start doing it. So this is, I think, on my side of performance, I think that's where it's going. It'll continue to grow, and um, it's cool to talk to parents too, who they train the physical side. They're working with that they're having the kids work with like private coaches and
Yeah.
hitting
Yeah.
coaches or whatever, right? And but now they're like, hey, we my I just got a call today, say, hey, my son's a quarterback and he's dealing with some stuff, can you help him? Like, absolutely, So
Hmm.
it's I'm not having to be a salesman as much as I once did,
Hmm.
and because before when I first started, I was just like, just to be able to get people to be open to hearing me out, like, hey, how this stuff can help you. Again, I'm not selling something that I don't believe in, or I'm not selling some used car or anything like that. This is real good stuff, So
Yeah, yeah.
and it just intertwines so much with like what you do and how you help your athletes, So
Hmm.
that's how one of the many reasons why I want to bring you on to kind of talk about that kind of intersection, because it definitely makes a difference in how we help athletes.
Yeah. And your example of them seeking you out, that's kind of how you and I got connected is I had a parent who I was treating her son, and her son is a fencer seeking the mental health services. And I was like, oh, I'm not the right person, but let me find somebody. And that's how I found you. And so I'm seeing it more and more being requested as well too. Yeah,
Good.
and it seems to be like you mentioned, the younger population that's seeking it out. The older population is still a little bit more um, resistant,
Uh-huh.
or maybe just not as knowledgeable. Maybe that's it.
Yeah.
Yeah,
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 I mean, it's a little bit of both. There's
yeah,
definitely resistance there, and just the old dogs not wanting to learn new tricks, kind of thing, right?
yeah,
And but yeah, this I think a big part of it is education, and that's why I appreciated that clinic, the conference I was at. The coordinator for bringing me on to talk about that, because that's the whole point of conference is to educate, to learn,
yeah,
to
yeah.
grow, and I was glad I had the opportunity, and hopefully those coaches took something of value out of it. So because yeah, that's a big part of when people are resistant to some things. It's a lot of times it's a lack of education, lack of awareness. You know,
Hmm.
I think
Yeah.
if we work on that, people will start realizing, oh, okay, maybe I should at least look into this stuff. So
Hmm. Exactly, man. Well, I'm on your side. I'm gonna promote as much as I can the mental side of this.
I appreciate you, brother. I
For
appreciate you.
sure,
Thank you
man.
so much.
Yeah.
Now, if there were people watching and they wanted to be like Dr. Carlos here, and kind of and work and do what you do, what is some advice that you would give them as far as like the steps that they can take?
Yeah, so if you want to become an athletic trainer and physical therapist, I guess the ideal path would be because right now, in order to become an athletic trainer, it's the master's route. And then to become a doctor of physical therapy or doctor of physical therapy, you have to go the doctorate route. So the path would be you get your undergrad, Then you do your 2 years, typically it's 2 years, master's in athletic training program. Do the prerequisites for the PT program while you're in your undergrad and master's, and then apply for the PT school and then get into a doctorate program. So it's quite a bit of schooling because you have your 4 years, and then typically 2 year master's, and then typically 3 year PT school. So what is that? 6, 7, 8, 9 years to become a PT/AT. And there are some programs that have a combined athletic training and physical therapy program. There's like one or two in the nation,
Mhm.
where I think instead of doing 2 years master's in athletic training and then 3 years, I think they condense it to 4 years for both programs, something like that. So that's one route that you can take as well too. Um, that would probably be the best thing, that route. And but the thing is, like after you get your doctorate, you might want to do a residency. After you get your physical therapy, doing a residency and doing a fellowship is not mandatory. Kind of like how med school, after med school, I think it's mandatory you do a residency. I think. I'm not 100% sure, but at PT school or after PT school, it's not mandatory you do a residency. And so you can even get even stronger in sports medicine by doing a residency in sports or a sports residency, they call it. After you do your sports residency, then you can do a fellowship in some type of branch of sports. So typically in the fellowship level, it's like an overhead athlete fellowship or a Division 1 physical therapist fellowship. The USOPC, US Olympic and Paralympic Committee, they have their own fellowship. Um, at least from what I can remember, they had it the last 2 years. I'm pretty sure they had it this year in 2025 as well too. Um, so those are the paths that you can take. I do recommend doing a residency and fellowship after. I know it's more schooling, but it will set you up, or I should say, it can set you up to go in the USOPC route. Another path is get your AT, get your PT, and then right after physical therapy school, you can do a 2 week rotation with the USOPC. But in order to qualify for that 2 week volunteer rotation with the USOPC, you have to have, I think, 3 years of work underneath your belt, and 2 years of that work have to be in sports. So even after, like, let's say you do want to do that 2 week volunteer rotation with the USOPC, you still have 3 years after physical therapy school to be able to qualify for that 2 week volunteer rotation. So within those 3 years, I would do that residency, I would do that fellowship. And yeah, and then a non-academic route would be this is more advice. So one of my instructors, I went to Cal State University Northridge, and in undergrad, one of my instructors, Dr. Stephen Loy, he changed up a saying. So you know the saying, it doesn't matter what you know, but who you know.
Mhm.
Yeah, right. So he one upped it and he says it doesn't matter who you know, it matters who knows you.
Mm. I like that.
So yeah, man, and that stuck with me too. I was like, dang, that's powerful. That
Yeah.
has a lot of meaning, like different layers of meaning. Because in order for somebody to get to know who you are, let's use me. In order for somebody to get to know who me, Carlos, is, I need to build a relationship with that person. They need to know my goals. They need to know where I came from. They need to know my passion. They need to know who I am as a person. So that person that now knows me, if there's an opportunity that they know I would be great, I would be a good fit for, they can now call me. The four teams that I work with USA Beach Volleyball, USA Fencing, US Soccer, and then USA Cycling. As an independent contractor, I never filled out an application. It was all people hitting me up like, "Hey, Carlos, yo, there's this opportunity. Cool. let me check it out, and boom, got in with USA Beach Volleyball. Got to meet people in USA Beach Volleyball. Got in with USA fencing, and then it just cascaded into just being able to work with more teams. And that's happened with other opportunities with other organizations also. It's just all word of mouth because people know who I am. I made these relationships, like actual relationships, and then not social media relationships, but like actual relationships with people, and they contact me whenever there's an opportunity that would fit me. Yeah.
That's powerful, man. That's oh man, I can't say that enough. I mean, I try to tell people, when people ask me for advice and career advice, regardless of whether it's like mental performance or otherwise, um, I couldn't have said it better. It tell people like reach out, set up informational interviews um,
Yeah.
and ask whatever questions you have, right, related to, do I need licensing? Do I need how many school, what kind of schooling or whatever, right? But what that also does, if you reach out and stay active and talk to people, build relationships, right, network, all that stuff, um, it puts you on their radar. That's why I tell people you put you on their radar, and
Yeah.
um, and there. I mean, you're a testament of that. You're a prime example of that, of how staying active because sometimes people it's like they sit on their hands and they wait for something just to fall into the lap without doing
Hmm.
without hustling, without building relationships, without connections.
Yeah.
And my response to that is like, good luck, right? Because it's gonna be a while, you know.
Yeah.
Um, because sometimes people say, oh, that person got lucky, they got that job, right? Well, more often than not, they made that luck. They put
Exactly.
themselves in that
Yeah.
position to get people who they're on someone's radar,
Hmm.
and where it doesn't, nine times out of ten, it just doesn't come out of out of the sky, So
Yeah. Like
um,
you said, they made that look. They made that happen.
yeah, yeah. So anyone watching, I don't care what industry you're looking to get into, you have to be hungry. You have to put in the work. Reach out to people, build relationships. Go grab a bite to eat. Whatever you gotta do, and sometimes you gotta get experience, especially if you're like fresh out of college, fresh out of grad school. I know, like I could speak on my industry. Sometimes that experience, it's pro bono, right? Sometimes you gotta
Hmm.
do stuff without getting paid, but you have to think long term,
Yeah.
right? Long term.
Hmm.
And I've done a lot of stuff, for free and pro bono, and just want to help people and see what happens. Sometimes I'm like, you know what, I'll do this workshop for free, or I'll do this, no charge, in hopes I get paid clients. And sometimes I do. Sometimes it doesn't really lead to anything. But at the very least, I get experience. At the very least,
Exactly.
at the very
Hmm.
least.
Hmm.
And
Or you make another connection.
Yeah,
Or yeah,
absolutely.
or you build that relationship with they
Uh-huh.
know you now. Yeah.
Yeah, I can't tell you how many times where I mean that football player, okay, the one I mentioned earlier, I gave a talk at this big athletic training facility in Orange County, who they train a lot of elite high school athletes, and this mom, her kid went to or is going to the academy, and this is it's been about 3 months since I gave him that talk. And she's like, yeah, my son said that you give a talk there, and he's he wants to talk with you, and the owner of the facility recommended me to you. So, I'm like, perfect, let's start, and there you go. Him and I are gonna start working now. So
Nice, man.
it's it's all the stuff that you got to put in the work, and I know some people don't want to do that, and I tell them, listen, you get what you put into it.
Big
So
time. Yeah. Yeah.
and that's regardless of whatever industry you're in, so
Hmm. Yeah.
well, hey man, I appreciate you taking the time to give me a lot of gold today, give us a lot of gold and a lot of great insight into your journey, into all the notable experiences that you had today. And I want to say appreciate you for coming on, man.
I mean, thank you for having me, man. It's a pleasure being here, man. Thank you.
Absolutely. Well, again, thank you for my guest, Dr. Carlos Roel, for coming on. Thank you for listening in. So don't forget to like, subscribe, and share. Okay, tell everyone what you saw today. Okay, and don't forget to take care of yourselves and each other. We'll see y'all in the next one. Bye.
See you guys.